Okay, so far with medical terminology, we've got 1 through 12. Got anticoagulant, stops blood from clotting. We've got apnea, without breath. Atherosclerosis, hardening of the arteries. Free of germs is aseptic or asepsis. Bacteriostatic is the same as sterile. A slow heart rate, less than 60 beats per minute, is bradycardia. I'm sorry. What's tachycardia? Fast heart rate, greater than what? Tachycardia, fast heart rate, greater than what? 100, right? Carcinoma is cancer. Study of the heart is cardiology. Cardiovascular is pertaining to the heart. To spin is to centrifuge. Cephalgia is headache. Formation of fibrin means a clot of blood, or the blood actually clots. So let's go ahead and do a new slide. Coagulate, we're being redundant here, right? Coagulate means to what? To clot, yeah. So if we have, if the blood's going to coagulate normally, isn't it? It's just going to coagulate. If you leave it sit, if you draw a tube of blood and you just leave it sit, the blood's going to clot, unless there's something in there to prevent the blood from clotting, such as another additive. So coagulate means to clot. Transmitted viruses or disease. Transmitted. Let's just put transmitted diseases. What does that mean? It's communicable, right? Okay, so let's make this bigger. Communicable. What does communicable mean? We went over, remember at the beginning how we went over the chain of infection, right? So what is communicable? What does it mean? You can pass it around, right? It's contagious. Contagious, communicable. So if you have if a patient has some type of communicable disease, they are going to be in what? What do we call that? Isolation. Yes. And what are the different types of isolation? This should be information that you remember. Reverse isolation. Very good, Sierra. Good. Reverse isolation, droplet precautions, respiratory precautions, contact precautions, all those are different types of isolation. So, crenated describes the blood cell as, it is a description. A lot of people have trouble with this. It is a description of the shape of a red blood cell. So basically it means notched. So notched is kind of like when you put your finger in cookie dough and you're making cookies and you've got that little notch. That's a red blood cell. It's kind of what it looks like. Biconcave little discs. Okay, let's go on to the next one. Loss 16. I'm not going to write all this. Loss of blood flow to the extremities when the feet and hands turn blue, which can happen in infants that are cold or in diabetics. So let's just sum this up. Reduced blood flow to extremities. I'm going to have to make that smaller. Let's make this smaller. (44) is basically what we call acrocyanosis. Acrocyanosis, after a period of time, I suppose it could be dangerous, but it's not immediately dangerous. Obviously, you want to warm somebody up. So if their hands or feet are turning blue, it's time to get a warm blanket, right? Warm them up. Alrighty, new slide. I will definitely test you guys on this next week. And because I'm going through all this, spelling is going to count. Okay? No, I can't spell. Spelling's going to count. adenoma. Adenoma is a tumor of the glands. So a tumor of the glands is adenoma. Usually they say when a tumor appears on someone, it's non-movable, hard nodules. I'm sorry? A knot, yes. It is like a knot, yes. With oxygen, okay, we did this when we did blood cultures. You should know this. I'm going to put OXY. Oh, somebody said it. What is it? Aerobic, yes. Aerobic is with oxygen. Very important to know this. Aerobic means with oxygen. And new slide. To attach. Now my dialysis students should know what this is, because when we talk about the cephalic vein and the brachial artery, or the basilic vein and the brachial artery, what do we call that in surgery? I showed you the surgical, remember the surgical video I showed you when they were creating a fistula? What did I say that was, that procedure when they attached the two, the artery and the vein? Anastomosis, right? Anastomosis is to what? Attach. So anastomosis is to attach. Okay. New slide. How would you describe anemia? Did anybody describe anemia on their paper?
Condition marked by a deficiency of a red blood cell.
Okay, there's lots of different kinds of anemia, but yes. So if you put down low iron in the blood or low red blood cell count, each of you would be right, because they're all different types of anemia. Pernicious anemia, microcytotic anemia. There's all different types of anemia. Oh, I've got to do one more. That's too big. 30.
It's low iron.
Low iron, yes, low iron in the blood. Alrighty, new slide. Low iron, anemia. Okay, so study of the intestinal system. Here's my example. So study of the intestinal system. And that is just way too big. What do we call this? Study of the intestinal system. Has a name. Yes. Wow, Sierra. You go. Gastroenterology. Okay, gastroenterology. That's how you spell it. I'm actually going to put these up on the website under medical terminology. So you can go through the slides. These are actually video slides. So you're going to see me doing what I'm doing now online. So exactly what we're doing. So let's go to new slide. Pertaining to the elderly, did anyone get this one? Yeah. Geriatrics, right? Geriatrics. Or pertaining to the elderly, geriatrics. I did. Oh, gastro. Well, 23. Oh, geez. Just okay. All right. Let me go back. Sorry. Let me just do this. Pertaining to the elderly is geriatrics. Study of the elderly is gerontology. So I'm going to add here, study of the elderly is gerontology. Gerontology. Okay, and then I added a new slide. I'm going to add another new slide. And we're going to go back to gastrointestinal, okay? And that's too big. So let's go back to 48. Gastrointestinal is pertaining to the GI system, okay? Pertaining to the GI or gastrointestinal system. We're referring to something gastrointestinal. It's in the stomach area, right? It's in the stomach area.
So 23 is in the stomach.
23 is pertaining to the GI system. Okay, so 25, a germicide. What is a germicide? Something that kills germs, yes. Germs and bacteria. It sounds like a commercial. What do we know that does that commercially? Lysol. Yeah, there's all kinds of germicides and disinfectants. Actually, Lysol kills a lot of different bacteria. It kills Klebsiella, AIDS, Hep B, Hep C. It's very, very good at what it does. Lysol people knew what they were doing, man. Okay, where are we now? Inflammation of the nephron. Now, my dialysis students didn't get this. I'm going to be so sad. I'm going to go home and cry if my dialysis students didn't answer this. Inflammation of the nephron. What is inflammation? Another word for inflammation of the nephron.
This is a long word that's kind of hard.
Don't defend the dialysis students. They should know this. I've got two of them right here. It is, yes, nephritis. Itis means what? Inflammation, okay? So anytime you see the ending of itis, it means inflammation, okay? If I were to highlight this itis right there, and I were to make it turn red, okay, let's see, this is what? Theme colors. I don't want to highlight. Let's make this red. See? This means inflammation. Okay, 28. Oh, man. Okay, gram stain. Gram stain. I went into quite a great detail on gram stain. What is the purpose of gram stain? What is the purpose? Why do we do it? If you don't get this. Yes. Yes. Say that again, Miss Catherine.
To identify the positive and negative bacteria.
A test to help identify positive or negative bacteria. I know this is weird. This is going to sound weird, but it seems like forever since I've seen all of you. It just seems like that. And I know I did a lecture on gram stain with this class. I talked about it. And actually you'll see that when you log in, week 2, I have the lecture on bacteria, and I add microbiology. I added some real cool visual aids. I actually had to buy them to add them because I wanted to give you that wow factor. So I think you'll appreciate it. I've got like this, while I'm talking about bacteria, I've got this bacterial petri dish growing bacteria, and it just kind of comes right out at you. Not any Universal Studios kind of stuff, but I thought it had a nice touch. So let's continue. All right, gram stain, study of the female reproductive system. Okay, so let me reverse this. Let me do study of the reproductive. Gynecology, right, is the study of the female reproductive system. I'm just reversing them. Okay. Here we go. 29. 29 says hematology. Hematology is what? Ology. I'm gonna start writing it. You finish it. Study. A study of the blood. Hema is what? Blood. Did I spell that right? Is it hema or hemo? Is it hemo? I got it right. Yay! Dyslexic person got it right. Very good. Okay, hematology is a study of the blood. Okay, so test for you guys, verbal here now. You are going to draw a CBC, complete blood count. What two? Say it all at once. Lavender, yeah, lavender tube, right? And what is the preservative in the lavender tube? EDTA. Very good. Very good. Okay, got points on that one. Feeling better now. New slide. So 30 says a fluid-filled sac containing ruptured RBCs. Now 30 and 31, that's the answer basically. 31 is the answer to 30. So what I'm going to do is combine 30 and 31 into one slide. So I'm going to put here hematoma, and underneath hematoma I'm going to put fluid-filled sac containing ruptured red blood cells. What is another word for rupturing red blood cells? Yes. Hemolysis. Remember that word? When the blood cells just rupture and they burst and they split. And if you have enough of those happening right under the skin, you're going to have a what? A hematoma, right? And what happens to hematomas? What do they start to look like? Black and blue, and sometimes they get green and yellow. Have you seen that? I don't know. What? It's a, yeah, it's exactly. Well, that is what a bruise is. So I'm going to write this down. Yes, Catherine, very good. Bruise. If I spell something wrong, please catch me, because I have a lot of students online. You know, they're like grammar, proficient grammar people, and I just can't keep up with them. So, yeah, I just want you guys to proofread as I'm going along. Okay. All right. So 32. You all know why I'm going to 32 now, right? Because 31 and 30 are, you know, like the answers to each other. So 32, rather than write all this down, I'm going to put the answer, which is hemophilia. And hemophilia is a hereditary disease of the blood in which the clotting mechanisms are absent. So hemophilia, the clotting factors are absent. Typically the two clotting factors in hemophilia are hemophilia 9, which is your 1X, and hemophilia, I should say 8 and 9, sorry. V11 is 8, right? You guys know your Roman numerals? I don't. Once you get past like 13 or 14, I get lost. There is, thank you, Catherine. There's hemophilia 8, factor 8, and factor 9. So this is 9 in Roman numerals. Okay, so that takes care of 32. What would you say a hemorrhage is? How would you define a hemorrhage? Someone is hemorrhaging. How would you define that? Right, blood loss, yeah. I would say profound. blood loss. That kind of makes it like worse than just blood loss. It means a lot of blood loss. Okay, so let's go to pertaining to the liver. So hepatic. So if we say the word hepatic, that means that we are referring, okay, pertaining to the liver, hepatic. Hepatomegaly, what do you think hepatomegaly is? Hepatomegaly, it's a big word, right? It means enlarged liver, okay? Enlarged liver. What do you think splenomegaly means? What? Enlarged what? You said it. Yes, enlarged spleen. How about cardiomegaly? Cardiomegaly. Enlarged heart. Yeah. See how that works? Megaly-itis is inflammation. Megaly is big. Ology is study of. You see how the everything kind of comes down to just knowing the Latin suffixes and prefixes. Okay, endocrine or endocrine secretion. So any type of endocrine secretion are hormones. Okay? Hormones are endocrine secretions. Hormones are endocrine secretions. 37, hyperkalemia. So let's take a look at 37. Hyperkalemia, look for the K. I am going to highlight the K right here, and I'm going to turn it red. Cool stuff you can do here. Why am I turning this red? Because this means elevated, right, potassium. So if potassium is 3.5 to 5.5, most say 5 milligrams per deciliter. So I would say the level of potassium, which is a K, which is a plus sign, greater than 5.5 milligrams per deciliter. Okay, why is there? I want greater than.
Greater than 5.5.
Yes, elevated potassium. So the K signifies with a plus sign the potassium ion, because potassium likes to stay in the +1 state because it's part of the group of alkaline metals of the periodic table of elements, group 1. Okay, so 38, increased sodium. Increased sodium is the same thing as saying hypernatremia, right? And so so sodium, Na, with a little plus sign, means sodium. And if it's greater than 145 milligrams per deciliter, then you have hypernatremia. Okay, hypernatremia, increased sodium. So look, this little N, if you make it red, you'll remember that it is, what? It is sodium. N for sodium, K for potassium, right? Hypernatremia. Okay, new slide. Hypochromic. Very interesting. Hypochromic. So when we talk about hypochromic, we're talking about the color. As it pertains, we're talking about color as it pertains to the red blood cells. So hypochromic means low in the bright red color, meaning the patient's blood cells are anemic. Hypochromic red blood cells mean they don't have enough iron at the heme center. They don't have enough iron, they don't have enough oxygen. Oxygen and iron is what makes the red blood cells red, like this red dish here. Bright red. Red blood cells, yeah? That's oxygen and iron that makes this beautiful red color. If the cells are hypochromic and we're looking at them under a slide and we see, wow, these are not red anymore, the first thing you want to think of is some type of anemia. Okay? Does that make sense? Hypochromic? Low potassium. So I think you know this now that we just went over this. So I'm going to put hypo. I thought you'd all just say that with me in unison. So I was right. Hypokalemia, yes. Low potassium, right? Less than 3.5 milligrams per deciliter. Now, my dialysis people, you need to know these values. These are values you need to know. You should have just been writing all these off. Okay, so low potassium, right? Because potassium is the K with the plus sign. So hypokalemia, again with the K, I'm going to highlight the K in red, means potassium, right? K is potassium. So let me just put this in parentheses here. So we're learning our medical terminology one by one. It's great. Okay, hypochromic, low potassium. What do you think of this now? Hyponatremia. What am I going to highlight here? The N for what? Sodium. Absolutely. So this means low sodium, or a sodium level, positive, right? Less than 135 milligrams per deciliter. Okay, hyponatremia, low sodium. Alrighty, 42. Removal of female reproductive organs. Okay, so I'm going to put ectomy. Oh my goodness, what does ectomy mean? Removal, right? Otomy is incision, ectomy is removal. So this is removal of female reproductive organs. Now there's partial hysterectomies, there's full hysterectomies, total hysterectomies. There's different hysterectomies. I don't know if you've heard of that. Sometimes they'll just remove the ovaries, sometimes they'll remove everything. The uterus and everything. So, all right. Ileitis. Okay, ileitis is inflammation of the ileum. So, new slide. ILETIS. Inflammation. Of the ileum. Now the ileum is of the bowel. Okay, ileitis. So ileum is of the bowel. So if someone with ileitis may have Crohn's disease, may have Hirschsprung's disease, they may have irritable bowel syndrome that's causing bowel inflammation. So where exactly the physicians have to do detailed examination of the individual to determine where in the bowel, whether it's the ascending, the descending, the transverse colon, the ileum, the duodenum, they've got to look for it. So people with this problem, it can be very troublesome, very bothersome. Okay, Let's take a look at 44, which is growth time using heat, which stands for incubation. Okay. So growth time using heat, incubation. So we incubate for our gram-negative, gram-positive, right? We want to grow blood cultures, or we just want to grow bacteria and our viruses. We typically incubate above 93 degrees Fahrenheit. And bacteria love to grow where? In dark, moist places. That is the dark, moist, warm places. Best growth mediums for bacteria. Okay, 45, infarct means dead tissue. Okay, particularly we talk about an infarct, we talk about a heart attack. So an infarct means we're going to put dead cardiac muscle tissue, a form of heart attack. So a heart attack, someone has a heart attack, they have an infarct, also known as a MI or myocardial infarction from infarct. And then 46, let's do 46, inflammation, redness, and increased white blood cell count. This is basically telling us someone has a what? A what? Yeah, an infection. So the signs and 5 cardinal symptoms of signs and symptoms of infection are what? 1, redness. 2, tenderness. 3, swelling. 4, warmth. Yes. 5, purulent drainage, or what do we call it? Pus, right? That yellow, greenish, foul-smelling drainage, purulent drainage, or pus. Alrighty. Oncology. And 47, I don't know. I have to say this. It may seem inappropriate, but it's funny. It's really happened in class. I can't remember how many years ago. Maybe 8, 9 years ago. I don't know. What is the plural of pus? Yeah. Don't even say it. Leave it to the... yeah, right? There is no plural of pus. That's okay. I just had to say that. It was just funny. Because somebody actually wrote it down. And I had to go to her paper and she said, so, she wasn't pointing that out to me. She just wrote, drainage. And it was she's very serious about it. And I looked at it and I'm thinking, no, that's not what you write for that word. That is not it. No. Okay, so oncology, we're going to go to 50, then we're going to take a short break, and we're going to finish this today, and that's a lot, isn't it? Jeez Louise. No, it's not so bad. We can do this. And then I'm going to this is being recorded, so I'm going to put it up on the website, so you can go through this. But let's just go ahead and oncology. So we're at oncology, right? What's oncology? Who's on an oncology unit? So it is the study of cancer, right? Oncology, the study of cancer. Ology, cardiology, remember? Yes, mean the study of the heart. Very good. Gravy. Okay. Study of the eyes. Study of the eyes. All right, let's spell this right now. Ophthalmology, yeah. Study of the eyes. Ophthalmology. Study of the eyes. Otitis. Otitis. Think about this now. If any of you have children, or if you remember when you were a kid and the doctor gave you a diagnosis of otitis media, what did he say you had? An ear infection. You had an ear infection. So otitis is a ear infection. Okay? So let's do this, my friends. Now that we've got ear infection, you should know this. And believe it or not, some of these abbreviations really confound me. And you just have to commit them to memory because, watch what I'm going to do. So ear infection, right? A-U, both ears. Okay? A-D, right ear. A-S, left ear. See that? And the same with eyes. When we talk about eyes. So if I were just to add a new slide here, and oh well, how would I do this? Let me see. So we're talking about eyes, like conjunctivitis of the conjunctiva of the eye. Let me just write, because I want to give you this. So abbreviations for eyes. So OD, right eye. This is something that's not in there. I'm writing this down, okay? OS, both eyes. No, sorry, that's left eye. See? Left eye. And then OU is both eyes. Something you should know. I think it's important if you get abbreviated. Not that phlebotomists or even dialysis people are going to run into this, but you might. So you want to know what it is. Okay? And then last 150 before we take a break, to apply controlled pressure to internal organs is palpation. That is the definition of palpation, everybody. So 50, I'll put down the answer, and the application of direct controlled, is there two L's in control? Just doesn't look like. Right. The application of direct controlled pressure to the internal organs. Yes. And we are on 50. We are going to push pause. Pause. Sorry. This is Nancy with Phlebotomy Career Training. How can I help you? Yeah, I'm recording now. So alkaline phosphatase, what is it?
Enzyme, the wrong answer.
It is an enzyme. Anything with an ACE is an enzyme. So that would be correct. Very good. But it's also a marker for inflammation. Okay? So very good. If you got that, beautiful. Let's go to the new slide. We'll go. These are going to go quickly now. NH4, the ammonium ion. NH and then 4 plus is the ammonium ion. Ions mean that they're free floating. They're charged. It has a charge, so it's the ammonium ion. Great, there it is. Thank you. AMM. Thanks, Catherine. You are amazing. You just saved my bacon there. Ammonium ion. Bilirubin. Okay, bilirubin. The gallbladder produces bilirubin. It is a bile produced by the gallbladder. And a lot of times when we measure bilirubin levels, we have total bilirubin, such as total and direct. Okay, so bilirubin is necessary. The liver also makes bilirubin, and the gallbladder also produces it. Mostly, it's mainly found in the gallbladder, and it helps to digest fats and things like that. So it's assistive in digestion. 3 times per day is TID. 3 times per day, TID. TPR, TPR. Yes. Yes, temperature, very good. Pulse and respiration, very good. TPR. TURP, TURP, and I'll spell this out. It's the transureteral resection of the prostate gland. So men that go in for prostatectomy, where the prostate is removed, they usually do a TURP. This is an operation. Okay, let's go to the new slide. Now, VDRL is a lab test for venereal disease. So it is a blood test for STDs, which mean what? Sexually transmitted diseases, right? So VDRL. So if you see a VDRL, you're doing a test for STDs. And we are going to look at another type of VDRL type test. It's called the Torches panel, and we're going to review that. WBCs are what? White blood cells. And what is the level that indicates someone has an infection? Greater than 10,000. So greater than 10,000 means that if they have enough white cells that are greater than 10,000 in a blood test, then they usually have an infection, okay? New slide. Little m, capital E, little q, / capital L, stands for milliequivalents. That's what that stands for. Milliequivalents. I think I spelled that wrong. So let me go back and check that. Is it MILLI or is it 1L? 1L. EQUIVA 1L. Yes, there we are. Milliequivalents. That's what that stands for. It's a measurement. Capital M, little g, or little m, little g, MILLIGRAMS, milligrams, right? MGs, milligrams. Milligrams. All right, new slide. We're going. ML, little m, capital L, milliliters. MILLILITERS, milliliters. So you can actually write milliliters like this. Little m, capital L. It's very specific in medicine right now. How you write things or abbreviate things, they've got very strict regulations on them so people don't make mistakes that can cause overdose or medication errors. Medical lab technician, MLT. So this stands for medical lab or laboratory technician. Okay, new slide. O and P. So if you're doing an O and P, you're doing what we call ova and parasites. Ova and parasites. Now, they draw an immunoglobulin IgE, for instance, they draw, let's say, for instance, an IgE. We can look for parasites drawing that immunoglobulin. This is usually a stool specimen. So this is a stool specimen. Ova and parasites. You may be collecting stool specimens. I don't know. As a phlebotomist, people might bring in their stool specimens to the lab. A lot of times they'll do them at home, but it's not so much for ova.
Poop stool.
A poop stool, yes. Poop stool.
Maybe put like a prop on it and then show it to the out.
Yes. Yes. But that's not ova and parasites. Ova and parasites are enteric parasites that are growing and living in the stool and in the bowel. But you're talking about blood in the stool. But yes, that is a common test that people will bring in. They'll do it at home and they'll bring it into you. Yep.
They got little things.
Yeah, they can tell whether or not there's blood in the stool. So, okay, 64. PC means after meals. So PC means after meals. PKU, phenylketonuria. So pH, phenylketonuria is a test that they do on babies. It's a little heel stick. Yes, to be sure that they are not going to become, they don't have this, this can cause mental retardation quickly after birth. So PKUs are usually drawn every day for about 3 days. If they suspect, they'll do a PKU. So, and QNS, this is something you don't want to run into as a phlebotomist, or if you're drawing any type of specimen. This means quantity non-sufficient. You don't have enough, which will happen if you did not know that the light blue tubes have to be filled to the top, right? Now you know that light blue tubes have to be filled to the top, so you won't get a QNS specimen. I'm so sorry. RBCs, yes. RBCs stand for red blood cells. REDBLOODCELLS. Very good. Sedimentation rate is something that you will see under when they do a CBC. So it's called ESR, which stands for ERY, erythrocyte sedimentation rate. So the erythrocyte sedimentation rate is a test that's done in the lavender tubes. So this particular guy is going to measure how the red blood cells or erythrocytes fall through the plasma, the rate of descent through a viscous medium. If they have a rate that they have to fall at, if they're sickled, where there's not much left of the red blood cell, just a little bit of tissue, it's going to take a long time to get through the plasma. So the longer the erythrocyte sedimentation rate, the greater the concern that there's a blood-related disease. So erythrocyte sedimentation rate is kind of an important test. RPR, rapid plasminogen rapid plasma reagent. We do RPRs when we are trying to test something rapidly. It is a rapid test. For instance, I got stuck with a dirty needle, and I had to go down to ER. And I went down to ER, and they did a RPR on me, or a PRP. I think it was a PRP, not a RPR, but PLASMA. So the point of it is, if it says rapid, it's a way of testing very quickly what's in the blood. If you've got any immunoglobulins developing to a virus or something of that nature. So specific gravity. Specific gravity, basically we test this. We'll test this with the blood, but you see it mostly with urine. Urine is 1.04 grams per mLs. So it is basically the measure of density. It's a measure of density. Actually, the specific gravity of urine is not too much different than water. It's just by 100th of it, you know, percent off. Stat. What does stat mean? Yeah, so if we put down, you've got something ordered stat, it means immediately. So stat is immediate. Hematocrit. Hematocrit are your as a percentage of the RBCs. Okay, hematocrit measures the percentage of red blood cells. HDL is part of your lipid panel, which stands for high density lipoproteins. This is the good cholesterol, by the way, the HDL. The LDL is the bad. New slide. Going quickly here. Hemoglobin, H, little g, B. Is abbreviation for HEMOGLOBIN, hemoglobin. HS means hour of sleep. But typically it's written HS. It just simply means at night or hour of sleep. Something's given at HS. Okay. Intermuscular. IM means intra. Oops, sorry. Hey there, my friend. Alrighty, meet you in a few. Alright, bye. Sorry about that. Intermuscular. Intermuscular, IM. Nobody likes an IM injection, right? Nobody does. I'm getting one, actually, today. I have to get my last Hep B. Pretty sure that's IM. I can't remember. I know tetanus was IM. I'm kind of hoping Hep B is sub-Q, but I don't know. I can't remember. I got hit with so many at the same time. It's hard to recall. Okie dokie. That was IM. Where am I? I am INO. INO. What do you think INO means? Intake and output. Intravenous, what does that mean? IV, yeah. So intravenous means IV. These are all just abbreviations, so this is pretty good. Kilogram, kg, kilogram, K-I-L-O-G-R-A-M. Abbreviation, capital K, little g. Measure of mass. This is, by the way, a measure of mass, not of weight. Okay, weight incorporates gravitational force. So kilogram is a measure of mass. Remember, your mass doesn't change no matter where you are in the world or in the universe. You could be floating on the constellation of Orion, and your mass will stay the same. Weight is a measure of your mass and how it's affected by gravity on the surface of wherever you're standing. So when we talk about weight, we're talking about the force, the gravitational force of the Earth or a planet on your mass. So if you were on the moon, your mass is like 1/6. Your weight is 1/6 of the Earth. Because we're talking kilograms, just as an FYI, if we take 9.81 meters per second squared, which is acceleration due to the force of gravity, and multiply it times kilograms, or how many kilograms someone's mass is, then we're going to get a Newton of force. And that Newton of force is the amount of force that you exert when you stand on a flat surface, or any surface for that matter. TMI, right? No problem. Continuing on. Liter. So liter, and this is kind of good that you're getting these abbreviations, because liter must be abbreviated capital L. Has to be abbreviated capital L. Other than that, it looks like a 1. GTT? I'm thinking Grand Theft Auto. No, but it's not an A. Sorry. That's a very violent game, by the way. This is a glucose tolerance test. So anytime you see a GTT capitalized, remember this. Capitalized is glucose tolerance test. If you have a small GTT with an S, that equals drops. Okay? So capital GTT is glucose tolerance test, small GTT is drops. And hepatitis A virus, so this would be written H little e P capital A capital V. So it stands for the hepatitis A virus. Now it's not telling you what it's testing for. So if I added antigen antibody or core antibody or antigen antibody complex, then we would know that we're doing immunoglobulins. So immunoglobulin M means recent infection, immunoglobulin G means a chronic infection. So typically if someone just becomes infected, and you know hepatitis A, right? Where do we get hepatitis A from? Food outbreaks. The lettuce, vegetables, strawberries, okay, hepatitis A. Hepatitis A is going to run the gamut. The person will become jaundice. They will become that yellow color, kind of like the phlebotomy arms that you have in front of you. Those are kind of jaundice looking, actually, pteric. But once it runs its course, it's gone. You have immunity to hepatitis A. Not so much with hep B or C, okay? All right, so if I wrote this down, if I wrote capital H, capital B, S, A, little g, what does this stand for? It stands for hepatitis B surface antigen. Okay, so the antigen means if you've got the antigen, you're infected. Right? You've got the antigen. You're infected. Jill, would you mind shutting the door, please? Thank you so much. Let's go on to the next slide. Fasting blood sugar, which is a FBS. So this stands for fasting blood sugar. Okay, fasting blood sugar, which actually you can do if someone is fasting. You can draw a fasting blood sugar in a serum separator tube, by the way. It doesn't necessarily have to be in a gray top tube with the sodium fluoride and potassium oxalate. You can do fasting in the morning before a patient eats in a serum separator tube. Okie dokie. So that was that one, right? Fasting blood sugar. Let's go on to, we're moving, doing good here. CRP. So CRP means C-reactive protein. C-reactive protein is also a test for inflammation. CVA means a cardiovascular accident. Oh, sorry, cerebral vascular accident, which is another word for a what? Stroke, right? Cerebral vascular accident. There's no such thing as cardiovascular accident, so cross out 86, please. Cross out 86, yes. Cross that out. AFP. AFP is alpha feto protein, and this is testing for Down syndrome. So, did I spell that right, Catherine? Syndrome?
Down syndrome. Not an S.
Thank you. Syndrome's right, though, right?
Yeah.
Thank you. So it's a test for Down syndrome. Drops, I don't have to go over that because I did that. Pharyngitis means inflammation of the what?
Pharynx.
Yeah, the pharynx. So inflammation of okay, double check my spelling on that. Okie doke. 90. Serology is the study of serum, of blood serum. Remember, blood serum doesn't contain clotting factors. FYI, big point. Might want to write that down somewhere. Thrombophlebitis is a blood clot. So, usually it's in a vein. So it's a venous blood clot. A lot of times you'll find blood clots in the legs, so thrombophlebitis, venous blood clot, thrombo-PHLEB, phlebitis, inflammation, right? Study of the urinary tract, urology. Urology. Study of the urinary tract, urology. Neoplasm is a type of tumor. Typically benign, non-malignant. Neoplasm doesn't have, I mean, just think of it as tumor. Okie doke. Infection, inflammation of the nephron, we did that, nephritis. Myocarditis is inflammation of the myocardium. And the myocardium is the middle layer of the heart. A yeast infection, 96, the yeast infection, or candida, it's just candida infection. Typically, we treat that with nystatin. I'm not sure what I want you to do with this one. I'm not really sure, so don't worry about it. Lysis means to separate. So lysis means S-E-P-A-R-A-T-E. Lysis means to separate. So hemolysis means what? Blood, the separation of blood, right? So you see how we're putting these together? Excessive fat in the blood is L-I-P, I before E, I-E, M-I-C. Lipemic, this is excessive fat in the blood. It's actually floating. So if someone's fasting and you draw their blood and there's this white frothy floating stuff on top, they haven't been fasting. They were at Bob Evans or IHOP, okay? And they're just dusting off the little powdered sugar on their shirt because they just had waffles. They would have, anyone eats a big, heavy carb, fat meal, well, if you draw blood right after it, you're going to get a lipemic specimen. That's how you know someone's not fasting. Leukocytosis, that's a high white blood cell count. So elevated, so leukocytosis, L-E-U-K-O-C-Y-T-O-S-I-S, elevated white blood cell count greater than 10,000. Okay. New slide. Increase in ketones in the liver, blood, or kidneys. So ketosis, my friends. Ketosis is also a complication when someone is a bodybuilder and they're heavily exercising they'll have excessive ketones. In diabetic ketoacidosis, you'll have excessive ketones. So basically this just means excessive ketones in the blood. Okay, not good. Isolation, we don't need to know that. Loss of blood flow. If you tie a tourniquet too long, what happens? You get loss of blood flow, right? So ischemia, which is loss of blood flow, which happens if you're leaving a tourniquet on for longer than 60 seconds. Bleeding time. Okay, basically bleeding time just means how long it takes for the blood to clot. I don't have to write that down. Bleeding time, it's a test. I'll write it down. Okay, so bleeding time is a test. It measures the time it takes blood to clot. And they actually cut you. It's rather barbaric. They cut you and they watch you bleed and they time it. Sounds very barbaric. It's like, we will determine how fast it takes for you to bleed out by cutting you, and we will measure it. When you start passing out, we'll know. I mean, it just seems rather barbaric. I don't know. Maybe that's just me. A test to determine organism growing in the blood, that was what? Gram stain, right? That was our gram stain. We did that already. Blood urea nitrogen, BUN, guys. Blood urea nitrogen. Blood urea nitrogen. Look at us speeding along. Let's do these and have a lunch. What say ye? CA.
Cancer.
It can be. You know, typically they don't abbreviate cancer. I mean, they basically write cancer. I want you to do this. If you see this, a capital C, a little A, and a 2 with a plus sign, that means calcium. Make it into calcium, okay? New slide, electrolytes, and I apologize for any of the interruptions we've had thus far. Electrolytes, electrolytes, are, dare I ask my dialysis students here, dare I? Sodium, I'll start it out. Potassium, chloride, I'm going to go cry. Thank you, Kara, CO2. Those are your electrolytes. Very important, okay? We need to know our electrolytes. Crap. Go away, sorry. All right, all right, here's one. I like this one. C6. Okay, come on, where am I? C6, H12O6 is the molecular formula for glucose. Okay, glucose tolerance test. I'm not going to redo that because I did it already. GTT. HCT, I did it. Abbreviation for hematocrit. Hemoglobin, I did it. LD, lactate dehydrogenase. Okay, again, it is an enzyme. Anything ending in ACE is an enzyme. So, LD, lactate dehydrogenase. I can spell the big words. Big words are not problems, the little words. What does it measure? Lactate dehydrogenase. Basically, it's a factor that we look for in implicated in certain types of diseases that inhibit the manufacturing of lactate, like people that are lactose intolerant. You know, also lactate dehydrogenase is implicated, I want to say, too, in certain prostate diseases. PTT, partial thrombin plastin time. I'm not going to have that. Is That is a test we're going to go over more in depth, but just abbreviation would be PTT. And a liver enzyme, any liver enzyme you can think of would work. AST, ALT, any enzyme, even lactate dehydrogenase is a liver enzyme. Because think about this before we go to lunch in like 5 minutes, right? The liver does a couple of things. So what does the liver do? The liver can manufacture glucose if there's not enough glucose floating in our blood through gluconeogenesis. So gluconeogenesis, the liver takes the glycogen stores and turns them into sugar and sends them out into the blood. Very cool. And also through glycogenolysis, the liver can take carbohydrates and break down carbohydrates and throw them into the blood as well. So the liver can do a lot. Enzymes, typically when we look at enzymes, there's a negative feedback with any type of disease process that's taking place in the body. And if your enzymes are off, that's usually a bad sign. Something's not working properly, right? So let's take a lunch. Let's be back here around 12. We're going to go over blood. We're going to cover, actually, before we do that, we're going to go over order of draw again. Okay? Alrighty. Thank you so much, everybody.